I am not a prognosticator. I cannot predict what will happen with the Chinese coronavirus here in the United States. What I can tell you is the one-to-one comparisons between Italy and the United States during this coronavirus outbreak are simply not accurate. I'm sure you've all heard the narrative. The U.S. is 10 days behind Italy. In 10 days, we are going to suffer mass death, and our emergency rooms are going to be overwhelmed and break down. More people will die, and the death rate is 4%, etc., etc. Tonight, I want to give you 5 reasons why the United States is not Italy. Reason number 1, Italy has the oldest per capita population in Europe, older than the United States, the second oldest in the world, except Japan. The average age of people dying from coronavirus in Italy is 81 years old. Reason number 2, Italy's population has a high percentage of smokers, which means people with underlying health conditions. The World Health Organization and other experts have told us the at-risk populations for COVID-19 are elderly people, people with compromised immune systems, and people with underlying health conditions. Italy has a high number of people who combine old age with underlying lung conditions, a higher percentage than the United States. Reason number 3, Italy has a different transmission issue than the United States. There are cultural differences, such as kissing, that impacts transmission. Italy is also part of China's Silk Road Economic Initiative with a direct line to, you guessed it, Wuhan, China. Reason number 4, Italy's single-payer healthcare system is failing. They have poor primary care, so people don't see their own doctor, they go directly to the emergency room. Italy's emergency rooms collapsed with just 1,000 extra patients on day 10 of this virus outbreak. Italy's ERs also did not make an effort to isolate COVID-19 patients, at least at the beginning. Obviously, here in the United States, our emergency rooms have not collapsed, and we are well past 10 days into this virus outbreak. Reason number 5, Italy is not using a combination of antiviral drugs that South Korea has found to be effective in fighting COVID-19 because this combination of existing drugs is not the official World Health Organization prescription to treat COVID-19. South Korea is giving patients a drug called Kaletra or a drug called hydroxychloroquine. Italy is not. Now, could things change? Sure. I'm not a genie with a crystal ball, but neither is anybody else. Right now, a lot of people are fear-mongering, pointing to Italy and saying the U.S. is 10 days behind Italy, and that's about to be us dying. But the one-to-one comparison doesn't add up. Here's the reality. Day 13 in Italy versus day 13 in the United States. The death rate in Italy was 4%. The death rate in the United States on the same day, day 13, was 1.8%. So what's going to happen here in the United States with COVID-19? I don't know. But the one-to-one comparison with Italy is not based on numbers, because you just saw the numbers and the 5 major differences between the United States and Italy, and it does not add up. Since the mainstream media will not tell you these facts, we will.